market crashed, 08, 09 crash. 09, 010, you could tell a lot of the states made up their income statements with a lot of TARP money and whatnot. 10, 11, there was a lot of accounting tricks that people did, including here in California. And 11, 12, they kind of ran out of places to go, and we have seen massive, massive pushback on pricing. Once a kid gets on an airplane, they can fly anywhere, and so where they go in the country is really, really, really price dependent at this juncture. And you can hear it on the telephone when you're on the other end of a telephone talking to the folks of various states, flying kids around. These are usually state Medicaid programs and whatnot, really struggling to make budgets meet and whatnot. See, that's the same thing in a lot of the health plans and others who are connected usually to state health plans, like a Medicaid program and what. So there's obviously a huge push, and even this morning, Packard, we were on the phone, actually about 10 people, talking about our own health plan and where we're going with it, trying to miss the excise taxes coming up in a few years and things like this. But all employers, SU, who owns us and everything, are very cost conscious on what they spend on health benefits. So I think whether, in a week or two here, I guess, or a couple months, we'll hear about what happens with the PPACA or Obamacare, what do you want to call that. But irrespective of where that goes, it's kind of like the jig is up on the high cost of health care. Something's going to have to change. Employers are really pushing, and obviously all of you know that probably even better than I. But certainly states and governments, things like that, they're really behind. They're really behind the curve and trying very, very hard to cut back.
Thank you, Tim. Liz, you had some comments about the bigger economy.
Well, I think that as you look around, we're very lucky to be in a place where there's a lot of employment and people do well. But everyone's struggling. The entire nation is struggling to make ends meet. Housing is falling. There are money pressures everywhere, and obviously there are going to be money pressures on health care. Along with that, we have people getting older. There's more retired people. There's more demand for health care. There's more availability and awareness of what you can get for health. Parents of these very sick children become incredible advocates for their care. So instead of sitting at home and saying, well, gosh, I have this disabled child, they really know. They can go on the internet. They can see what's available. They can fight for that. People who are older, they say, well, gosh, I looked on the internet and I can have this knee replaced and this knee replaced and my ankle replaced and all that other thing done. And we have been able to do that. And that's we're not going to be able to continue that kind of constant care. I would disagree that it's earnings is a large difference in cost of care in this country and others, but we could certainly agree to disagree on that. I think it's a multifactorial problem. Having said that, the train has left the station. Things are going to change. The practice is going to change. The way you receive health care is going to change. What you get and how you get it is going to change. And some of it is good. We're going to take away things that we don't need to do. It used to be if I checked your cholesterol and then I wanted to adjust your medicine, you came to my office and we talked about it. Now I email you, you email me back, and we're done. So I think we have to rationalize the way that we utilize the people that we have and the services that we have. But it's definitely going to change.
Thank you, Liz. I'd like to move toward talking about some of the realities of cost. The fact of the matter is, cost is one of the primary reasons why we're all here. So I'd like some of our panelists to make comments about how much do things cost, how does this all work together, and what are some of the numbers? Peter, can you kick us off?
Yeah, sure. I think there's a couple sets of books out there today, and I think some of the panelists that deliver care are going to be better able to speak to the differences in cost between what